Can antipsychotics harm Lewy body dementia patients? Can antipsychotics harm patients with Lewy body dementia? This is a crucial question for caregivers and healthcare providers. Antipsychotic medications can indeed pose significant risks for individuals with Lewy body dementia. Many people with this type of dementia show a heightened sensitivity to these drugs. This sensitivity can lead to a worsening of motor symptoms, cognitive function, and neuropsychiatric symptoms. In some cases, even a single dose can trigger serious adverse effects. Research indicates that patients with Lewy body dementia have a 30 to 50% risk of experiencing severe sensitivity to antipsychotic medications. This can result in profound sedation, increased rigidity, confusion, and even dysautonomia, which affects the autonomic nervous system. Alarmingly, these reactions can sometimes lead to life-threatening situations. Typical antipsychotics, like haloperidol, are particularly risky and are generally avoided in this population. However, atypical antipsychotics, while sometimes seen as safer, can also cause harmful effects. Currently, there is no definitive evidence that any specific atypical antipsychotic is completely safe for those with Lewy body dementia. The use of these medications is associated with increased risks, including stroke, faster cognitive decline, and higher mortality rates. Given these dangers, antipsychotics should only be used with extreme caution in patients with Lewy body dementia. They should be prescribed only when the benefits clearly outweigh the risks, such as in cases of severe psychosis or behavioral symptoms that could endanger the patient or others. Close clinical monitoring is essential during treatment. Some medications, like pimavanserin, have been FDA approved for managing psychosis in Parkinson's disease and may offer safer options for patients with Lewy body dementia. However, treatment must always be tailored to the individual. Caregivers and healthcare providers need to carefully weigh the risks of using antipsychotics against the potential distress caused by untreated psychosis or behavioral symptoms. Any new prescription should come with a plan for careful assessment and, if possible, a trial discontinuation. It is vital to communicate any side effects promptly and involve specialists who understand Lewy body dementia in treatment decisions. In summary, while antipsychotics can be necessary for managing severe symptoms in Lewy body dementia, they carry a high risk of serious adverse effects. Therefore, they should be prescribed cautiously, under close supervision, and with consideration of safer alternatives whenever possible. Always consult a healthcare professional for personalized advice and treatment options.